Hello and welcome. My name is Omar Shah. I'm a GP here in Midlands, UK. I'm recording this for the module activity. Today, I want to talk about something that affects a lot of people living with diabetes, but which often is completely unnoticed until it is quite advanced, a group of conditions called microvascular disease. I will explain you this in detail in further slides. By the end of this short video, you will understand that microvascular disease, what actually it is, why diabetes affects your smallest blood vessel, and most importantly, what can you do to protect your eyes, your kidneys, your nerves. Before we start, I want to say a quick word about why I am making this video. You might be spending a lot of time on social media, or even if you don't spend a lot of time, but you do see a huge amount of health information out there, and, and some of it is excellent regarding health, diet, diabetes, but frankly, some of it is really dangerous, and some of it is really unreliable. And diabetes is one topic which is really talked about a lot in social media, and there is misinformation which can really harm. So everything I cover today is not based on any opinion, any comments read in any sections, or any unreliable source. Is purely based on NHS and NICE guidance. So here, uh, what we'll cover first, what microvascular disease actually is, and why diabetes affects the small vessels. Then we'll go through the three main areas it affects: your eyes, your kidneys, and your nerves. And finally, the warning signs to look out for, the practical things you can do starting today to protect yourself. So, what is microvascular disease? Let's break down the word itself. Micro means small, vascular means the vessel. So, microvascular refers to the blood vessel. Vascular refers to the blood vessels. So, the microvascular disease simply means uh, if you say microvascular damage or disease means damage to the small blood vessels, the tiny capillaries that carry oxygen and nutrients to your organs. Over time, having too much glucose in the blood can gradually damage the blood walls and these tiny vessels, making them thicker, more fragile, and less effective doing their job. There's a different, this is really different from what is macrovascular, since there is a micro and there has to be a macro. So macrovascular disease, it affects large blood vessels, as the word itself says, macro. It affects, it can be a cause for heart attacks and strokes. But today, in this section, we are focusing on the small vessels, and in particular, the three main organs which are affected by these small vessel damage. It's your eyes, your kidneys, and the nerves. So let's talk about them, each of them, one by one. First, eyes. The eyes and the condition when the micro vessels are damaged in our eyes in the people who are diabetic, then we call it diabetic retinopathy. So at the back of our eyes is a layer of tissue called retina, which is what actually senses light and allows you to see. It's supplied by a network of fine vessels. The high sugar over a period of time can damage these vessels. They can leak, they can become blocked, and they can sometimes grow on a different size, and sometimes they grow very abnormally. They coil up, they cause different shapes, and they impair the vision. Here's a really important part. In its early stages, retinopathy usually causes no symptoms at all. Your vision can feel completely normal, while changes are already happening in the back of your eyes. you simply wouldn't know it. That's exactly why diabetes screening is offered every year, and in NHS, it's a yearly annual screening. It can pick up changes before they have made any change in your vision itself. And there is a treatment which can be done in early stages and may prevent you from further damage. If change is found, it can be taken control of. Good control of blood sugar, blood pressure, and of course cholesterol and other lipid profile can reduce the risk of retinopathy. It can prevent from getting worse, and the treatments like laser therapy or some injections in the eyes can really prevent it or can prevent further damage. So please, if you get a letter from your NHS eye screening and you're diabetic, please do visit. So now let's talk about diabetic kidney disease, or you can say diabetic nephropathy. Nephro here means kidney and pathy is the disease. Each of your kidney contains around 1 million tiny filtering units called nephron. It sounds a lot, but they are really needed, and each of its own network of small blood vessels. Over time, high blood sugar and blood pressure can damage these filters, in other words, nephrons. When that starts to happen, the kidneys begin to leak a small amount of a protein called albumin. And exactly like in eyes, when you are leaking this albumin, it doesn't cause any symptoms. It's often it's often very first sign that something is changing, and again it happens long before you will feel unwell. So how is it picked? At your annual diabetic review, or if you happen to visit your GP, they do a simple test. It's called a simple urine test to check for that microalbumin. And if they find the microalbumin is leaking, your GP, talk to your GP. If the GP picks it up, they will certainly act on it, and they know how to prevent the kidneys from there onwards. So now here's a simple, genuine good news. The GP knows how to do, and there's a huge guidance. There's something pillars how you can save the kidneys. There are multiple pillars for preventing the diabetic nephropathy. There are medications which can help. Some medications are blood pressure medicines called ACE inhibitors or ARBs. There's a group of medication now called SGLT2, and in the recent years, there's evidence that the new medications called GLP-1 weight loss injections or the diabetes treatment have been found to protect the kidneys, so that regardless of your blood sugar level, and controlling blood pressure is just as important as controlling the blood sugar. Early kidney disease can often be reversible, or at least can be slowed down significantly with these treatments. New treatments have a great evidence they help. So please do attend your diabetic annual reviews. And now the third area, it's the nerves, and the nerves are present everywhere. So when you have nerve damages with the diabetes, it's called diabetic peripheral neuropathy. Neuro means nerves, pathy, as we know, it's the disease. Nerves need healthy blood supply to work properly. Just like any other tissue, when the small blood vessels supplying the nerves are damaged, the nerves themselves become damaged too. This is most commonly affected in the feet and in the lower legs, and sometimes even hands. It starts usually with the legs and especially with the toes, because that's where the blood vessels are the tiniest, and it affects the tiniest first. Common symptom which the patients will have is tingling, pins and needles, numbness, burning feet, shooting pains, especially in the night, and some people notice the reduced ability to feel the pain and also reduced sensation of heat or injury, and this can result sometimes in burns, blisters, or poor healing of wounds also. The last point really important, so let's pause on it. If you can't feel a cut, a blister, a burn, a pressure sore, it can go unnoticed, and sometimes that can normally prompt you to stop and to deal with it because it hurts, might instantly silently getting worse. So if there was a pain, you would deal with it, but since there will be a less sensation, you might not feel it. Over time, that can lead to infections, poorly healing ulcers, and sometimes something called diabetic foot, which can be very, very serious and it is difficult to treat. That's why a quick daily look at your feet, at your toes, and annual foot examination with your healthcare team, your podiatry, is important. It's recommended for everyone with diabetes. A good footwear avoid walking barefoot and getting any wound, however small, should be checked promptly with this idea that this can lead to serious complications. Go to your GP if you find any small wound which is poorly healing. So we have covered the eyes, kidney, and the nerves, and you might be thinking that's a lot to keep track of. But here's the news. All three areas are affected by the same underlying factors, which means things that help one will help all three at once because the pathology is the same, the process is the same. It's the damage of the small vessels with high blood sugar. Those four factors, blood glucose, keep your HbA1c in the target range. You make a plan with your diabetes team, your GP, or a specialist. This will reduce the damage to the small vessels over time. Second, your blood pressure. Your blood pressure adds extra strain to your vessels that are already vulnerable. And your cholesterol. Managing this helps protect the blood vessel walls throughout the body. And smoking. Smoking narrows the blood vessels and significantly speeds up this kind of damage. So the good news is that stopping smoking has a rapid benefit. Even if you have been smoking for a long, no matter how long, wherever you stop smoking, there is a benefit. Even if you have smoked in the past for a long, you might think it's too late to stop, but you can stop at any point. There is a significant benefit in stopping. So really, one set of habits is doing a lot of protective work across the whole body. Now I want to be clear, most people with diabetes will go through life without ever experiencing any of these things. I'm about to describe especially if they are attending their regular checks, but it's important that you know what to watch for and when to get help promptly. If you notice a sudden change in your vision, new floaters, new dark spots, you urgently can go call 111, call your GP. If you have access to the eye clinic, go to the eye clinic. This needs to be looked at quickly. If you notice new swelling around your ankles or a significant change in how you are passing urine, mention this to your GP. If you see your weight gain or your knee ankles getting heavier, go and contact your GP. If you have cut, blisters, burns, redness at the foot that hasn't healed in few days, that doesn't hurt you a lot, you don't feel some sensation there, don't wait, contact your GP. And if you experience numbness, weakness, that's new, severe, or the pain is rapid, also needs quick chat with the GP, discuss with them. As a general rule, if you're in doubt, seek help, contact your GP, call 111, and for a sudden vision loss, very severe symptoms, straight away call 111, go to the hospital. so that you can actually do so what can you do starting today? So there are few things you can do practically. Number one, attend your diabetic annual reviews, attend your annual eye screening, do your kidney checks with your doctor, do your foot checks yourself, catch the problems early, seek help. Number two, take your medicines as prescribed. Your blood pressure medicines, your cholesterol medicines, your diabetes medicines, even on the days when you feel very well, do take them regularly. They are doing quite an important work in the background. They are preventing the complications. Number three, know the numbers. Know the numbers. Keep eye on your diabetes test, the HbA1c. Keep eye on your blood pressures and your cholesterol targets and how you are doing to keep them in check, to control them. You should understand your own results. If you don't, contact your GP, discuss with them, let them explain you each of them, and you're aware what you are targeting, what's your target, what are you going to achieve from them. Number four, move more. Keep your feet regularly, move regularly, regular activities, keep the circulation, and keep a daily look on your feet to catch a problem when it is early. One of the most important advice would be, please think about smoking if you smoke. Please make a plan to stop smoking, even if you have smoked for a long time. Ask the team for the support. There's a lot of support in community for the people who want to give up smoking. There are new ways to stop. Contact your GP. They will signpost you how to seek the help and the replacement. There is a pathway to stop smoking. This is one of the single most protective things you can do for your small blood vessels. If you take note, if you take nothing else from this video, maybe pick just one of the 5 things, or maybe at least take few things. If you want 3 things, control your diabetes, keep the eye on the numbers, control your blood pressure, and stop smoking. Take at least one of these things with you today. Let's bring everything now together. The 4 key things to remember. 1. Diabetes can damage the smallest blood vessels in your eyes, in your kidneys, and the nerves, and often happens silently with no early symptoms. 2. The annual screening for your eyes, kidneys, and feet is best early warning system, even when you are feeling completely well. 3. The managing your blood sugar, blood pressure, and cholesterol, and stop smoking all protect the blood vessels together. And 4. Know the warning signs and don't hesitate to contact the GP, your 111, or your specialist team. Just before we finish, an important note: this video is a general information. It's intended to help you understand what the microvascular disease is and why these checks matter. This isn't a substitute for your individual care. Everyone's diabetes is different and your personal targets are different. Medications are different. Screening schedule should be always agreed with your GP and followed in letter and script. Discuss with your GP, your diabetes nurse, or a specialist team. If anything in this video has caused questions about your health, please do get in touch with your practice. That's exactly why they are there. Thank you so much for watching, and take care of those blood vessels. They are working hard for you every day, every single minute of the day. Take care. Goodbye for now. Thank you.